Hospital admission flow admission from the ER. Here's a detailed scenario that introduces a person new to the U.S. healthcare system to what typically happens when a patient is admitted to a hospital from the emergency room. The flow includes the main steps and departments involved. Scenario: Mr. Ahmed's hospital admission journey. Background: Mr. Ahmed, a 62-year-old man who recently moved to the U.S., arrives at the emergency room at 9 p.m. with chest pain and shortness of breath. He speaks limited English, so an interpreter is called. 1. Emergency room ER. Initial assessment. Upon arrival, Mr. Ahmed checks in at the ER registration desk, where a staff member takes his name, date of birth, and reason for visit. He is quickly triaged by a nurse, who checks his vital signs, blood pressure, heart rate, temperature, oxygen level. Based on symptoms, he is classified as urgent and is taken to an ER bed. An interpreter assists throughout the process. 2. ER evaluation and diagnosis. A physician performs a physical exam and orders several tests: an EKG, electrocardiogram, blood tests, cardiac enzymes, a chest X-ray. A diagnosis of unstable angina is made, and the cardiology team is consulted. Mr. Ahmed is given medication and closely monitored. 3. Decision to admit. The cardiologist recommends hospital admission for observation, further testing, such as a stress test or cardiac catheterization, and to adjust his medications. The ER team contacts the hospitalist, inpatient physician, to take over Mr. Ahmed's care. A bed is requested in the telemetry unit, a specialized unit for heart monitoring. 4. Admission process. A bed coordinator or admissions nurse is notified once a bed is available. Mr. Ahmed is officially admitted to the hospital and assigned a room number. The admitting orders, e.g. diet, medications, tests, are entered into the hospital's electronic health record. 5. Transport to nursing unit. A patient transporter arrives and wheels Mr. Ahmed from the ER to the telemetry unit. He is greeted by the nursing staff, who get him settled into his room. 6. Nursing unit care. A registered nurse (RN) conducts an initial assessment, reviews his medical history, checks vital signs again, explains how to call for help and use the TV and bed controls. The charge nurse reviews his care plan and assigns a primary nurse. The interpreter remains available by phone or video, especially for critical updates. 7. Inpatient services and specialists. Mr. Ahmed is visited by the hospitalist, who coordinates care during the hospital stay, a cardiologist who orders a cardiac stress test, a pharmacist who reviews his medications, a dietitian who explains the heart-healthy diet provided. A case manager and social worker may visit to discuss discharge planning and any needs for home care or follow-up. 8. Ongoing monitoring and discharge. Over the next 48 hours, Mr. Ahmed is monitored, tested, and stabilized. Once he is medically stable, the team decides he can go home with a prescription and follow-up appointments. The case manager arranges outpatient cardiology follow-up and ensures he understands discharge instructions, with interpreter help. 9. After discharge, Mr. Ahmed receives a printed summary of his hospitalization and medications, information on how to refill prescriptions, phone numbers to call if symptoms return, follow-up care with his primary care physician and the cardiologist.